Hello, everyone, and welcome to another show of the Disruptive Front. Today, I have an amazing, awesome, very special guest, John Whyte, or should we say Dr. John Whyte from the WebMD. He is the Chief Medical Officer there. John, thank you so much for coming on the show today.
Absolutely. Great to be with you.
Yeah, and you and I have talked offline a lot about some of the things that are going on. I mean, there's some obvious, very rewarding things going on in research and policy side of things. But one thing that you and I really saw eye to eye on was the consumerism of a lot of this information and how to deliver that information, disseminate that information through the vehicles that patients, consumers, whatever we want to call them,
Mhm.
are accepting and receiving that. So it was really interesting talking to you and talking to you about your background and I was so happy to hear about the fact that you like policy and that's why you're in DC and probably won't leave because of it. So if you don't mind, we're going to jump right in with some health policy questions. Being that
Sure.
you're the face of what I say consumer medicine, I think it's
Mhm.
awesome to say that. In the past, and I kind of joked with you about this, that a lot of people said, "Don't go to WebMD to get information. Come to me." And then, with somebody, a leader like yourself, a voice for healthcare like yourself, is let's get rid of the myths. Let's get the facts. Let's get the
Yep.
truth. Let's get the direction to help guide our patients to being
Mhm.
healthier.
Well,
So
what's interesting is you said at the beginning, patients, consumers, whatever we call them, it actually does matter in many ways what we call them, because when we refer to them as consumers, it's a different mindset than typically in medicine. We'd say the heart patient in room 405 or the liver patient in room 609. And it's really this recognition that we have to focus on customer service when we talk about patients as consumers.
I absolutely love that, and I'm going to dig deep into that. So I'm glad that you brought that up because
Mhm.
I look at the Amazons of the world. I look at where people are familiar with
Mhm.
receiving. It's no more just about the sizzle on the steak, and I don't have one for vegetarians. Maybe the sizzle on the avocado. I don't know, but I will say let's jump into some health policy questions.
Sure.
I do have an interest in talking about we've seen Obamacare be tested. We've
Mhm.
seen a lot of these things be tested. There's a lot of health policies that limit access. Also, I do want to talk about what needs to be done to kind of open the floodgate for innovating vital tools such as
Mhm.
universal access to EHR. So, what are your thoughts on that and how do we get to that next level?
Well, it's frustrating that we've been talking about EHR for 10, 20 years, and we still have this issue of what's called interoperability. The different systems don't communicate. And then the whole issue in recent years of open access, that patients, consumers should have access to the information in their electronic health record, including their labs, doctor notes. That's a good thing. And we should be trying to figure out a way how to encourage that. And then also encourage patients to utilize that so they can ask questions, so they can be more informed. And you know what? Even check for errors, because there often are errors in electronic health records in terms of patient diagnoses, medicines. I still see patients, and when I review a patient's chart, sometimes I'm like, how did this get in here? So that's something where we really need to have technology meet the needs of consumers. And that's where I think it's really starting to change this focus from simply addressing the needs of providers and shifting it to the consumer. And that'll help things move along.
And coming from a physician yourself, that's probably not a conversation that has been had for 20 years ongoing of that idea of kind of giving more autonomy to the patient. A lot of times we, even in
Mhm.
pharmacy, we like to hold the information and even
Sure.
every business model likes to do that. But I think when you look at how much data is not being utilized because certain innovations are not, happening or being adopted, which we'll get into in a
Mhm.
little bit, but I think you're right. And I know you're right. I think we need to have more access, but I do think in order to treat patients, we need to all as a team, providers or pharmacists or
Mhm.
whomever, have access to that information so that we have a continuation of care versus a touch point. I think touch points we know they're there. Whether
Yeah.
they're affordable or not is a big barrier. Whether they're accessible in terms of time
Mhm.
frame. When I was growing up, I was wondering why was my mom always taking me out of school in order to go to the
Mhm.
physician. And I was thinking, I'm losing school and education. And a
Mhm.
lot of them weren't open on the weekends. And then that model changed, in pediatric world and so on. There is a lot going on with the idea of, you know, politicians not really also understanding fully about the technologies that exist and like
Mhm.
we look at congressional budgets and they only look at costs versus savings.
Mhm.
So how do we get in front of those legislators? Is it all of our healthcare professionals coming with a white coat? I don't want to say army because of what just happened, but a white coat, walk to the Congress and talk to everybody about, what needs to be done? Or is it,
Mhm.
just this kind of hope that it happens?
Well, there's always these type of doctor days that they have on the Hill, the state capitol, the federal government. Where I think you make where I think you make a big difference is sustaining that interaction over time, helping to educate members of legislatures, working with advocacy groups. So it shouldn't be physicians here and patients here and other providers here. It's all one continuum. And I think it's that constant engagement with health providers and with advocacy groups as well and legislators. But it's also, Scott, about talking about solutions. Too often people simply come and criticize the status quo. And that's okay. But if you really want to have an impact, what change should there be? And help come up with solutions. And that's something that I often did as a regulator. If you want to criticize an action of a federal agency, okay, well then how would you have handled it? What should we be doing?
Well, you
And
mean you mean Monday morning quarterbacks exist?
and sometimes people realize it's not that easy.
I don't know if your friend Tim Tebow would know about those Monday morning quarterbacks. Somebody telling him how to do his job on Monday after the big game. There's always that kind of idea that we know what's wrong. But
Right,
I always tell my students the same thing. Don't come to me without a solution. You could come with a
right,
complaint, but tell me where we're going. Tell me what your thought is, so that
absolutely.
we could get on the whiteboard and create an opportunity.
Yeah.
I think the same goes. Yeah, and we look at a lot of the groups. I've worked with many that kind of don't complain until it's losing a job.
Yeah.
And, I think if we put the patient's public health in front of
Mhm,
us, we'll always have a job. And then we can start to find solutions to actually push humanity forward and create solutions
right.
for the most vulnerable.
Mhm,
I do want to talk to you about some of the things that kind of relates to the vulnerable is, everything going on in the world. And
mhm,
because of it, there's a lot of grief and just mental health going on. There's a
mhm,
lot of passing that, I know that the current administration is talking about and so on,
mhm,
but I think that it's still stigmatized. My wife actually started a group to disrupt grief. And I thought it was
okay.
amazing because she's connecting with people from Gary Vee to,
Mhm,
professional athletes. And it's just, people are getting it because grief can be from losing somebody
yeah,
to, losing a relationship or, just a
mhm,
friendship. So I know that WebMD particularly has been very, innovative in their approach
mhm.
in the terms of vehicles and so on. I wanted to get your thoughts on what's being done and what kind of exciting things we're seeing in this space as well.
Well, we know that search around the topic of anxiety-related medications is 7 times this year than what it was last year. Same time frame a year later. And there's many reasons why that is. And part of what we're learning is that we really need to make it easy for people to acknowledge that they're having grief, they're having mental health symptoms. These are normal emotions to have. And sometimes they can be overwhelming, and that's okay. And how do we help people get assistance? Much of it is through telepsychiatry, telepsychology, and there's certainly a role for that. And we need to improve those services. I think we're starting to see more of those available. But part of it is also helping people along. There's a great campaign around, it's called How Are You Doing Really? Right? We don't often
How you doing?
take
Yeah,
time
nice to see you. How you doing? Yeah, yeah, good.
to
Yeah.
listen to people. It's kind of perfunctory, like just how are you doing? And let's move on. How was your weekend? Good. How was yours? Good. But we don't really take the time to understand what people are going through. And I think there's a greater recognition of that now. That's something that we've always been trying to do, to normalize mental health problems and to recognize that it's okay to be experiencing them. But then it goes to that next point. How do we provide resources? How do we provide help? How do we help them know where they can go and who they can access? So I see progress there, but still a lot more to do.
Well, and I see a lot of things that were available to people on a normal basis. So, for instance, I'm not going to just isolate a certain group, but if you have a bad week or it's a very hard week, it's like, let's go drinking on a Friday or like, let's, do something to kind of relieve
Mhm.
that. And I think without some of those things available, the reality of a lifestyle also sits in. And so now where it may have been a few that kind of didn't have that relief, now it's a lot of people are facing the same. So I think that companies, for years, I've been reading PwC reports about how companies have, brought in people, psychologists, teams have brought them in. I mean, I want to see this done in schools. I want to see where tuition pays for mental health, professionals. But I also think there needs to be education on who you need. When you have a problem, not only is it sometimes outsourced from payers, but it's hard to figure out, do I go to a psychiatrist? Do I need a social worker? Do I need a, mental health therapist in a specific area of grief or, of something else? And that resource is also missing. And so I think that, we got to keep on that subject and keep pushing the needle in that area and really destigmatizing it. So I commend WebMD for what you guys have done and putting tons of articles out. I like to look at the technologies that exist when you look at some of the heart rate monitors, sleep cycles, or even skin test, epidemic, why can't I think of this?
That's why you need to drink tea, Scott.
Yes.
Just drinking.
So ideally can see stress based on the skin. And I think when you think about things like that, a end point, we need to think about how to get it to the end user and adoption. And I think when you look at some of those devices at $300 a device, it's very hard. So I want to talk to you about that specifically. How do we get more of our vulnerable audience, whether it be consumers or patients, into this connectivity stage? Like, how do we connect more? Because there are a lot of people without internet today. A lot of people, maybe, do we go through the payers? Do the payers are, do the Blues of the world team up with the Comcast of the world and pay $10 like a, program per month, increase the usage because they have all these individuals under their umbrella, and say, hey, everybody's going to get connected. So all of our medical devices and connectivity and telehealth can be accepted and adopted.
Yeah, well, Scott, I think there's a couple of issues here. So there's the availability of broadband internet, the availability of wireless. And I'm not an expert in those technologies, but we do know in some areas of the country, in some counties, that we don't have as good internet service as people need for the use of telehealth, for the use of school. But the other element there that people sometimes forget is that it's often the tools that consumers have. So let's be realistic. Trying to do school on a cell phone is not ideal. You often can't see all the tabs well. It's very hard to type on those. So people also need to have the right resources even when they have access to broadband. And we need to recognize that. And how do we figure out how to pay for that and provide that? We don't want technology to create another divide, a digital divide that we're seeing that promotes disparity, inequity. So that's a real challenge too. So yes, let's get more broadband internet, but let's also make sure that we empower consumers with the right tools that they need to utilize that effectively. It's not just about broadband and a cell phone.
Well, I want to actually talk to you about the provider adoption on that side, because, you have consumer adoption, provider adoption is a big thing as well, because even some of the companies are going direct to consumer, which kind of cuts the training and the education out. Is it education that needs to be updated and modernized, or is it a interprofessional approach to these things, or is it more sales guys going to the office? That's, and I hate to say it in that way, but that's the kind of.
You mean in terms of what's available in the office?
Well, in the technology space, if we were going to adopt new technologies, you got a lot of private practices. You got a lot of health systems that don't have the same standard as other places. And I think, private practices have partnerships with different companies and offer different resources. So, my goal, I guess my thing is trying to get more providers to adopt. I look at the day that we have pharmacists giving you prescribing you an app as a means to kind of coincide with the therapy being, the treatment plan for that patient or that consumer. So how do we get more providers involved in technology?
I think part of the challenge is when providers hear EHR, that's what we heard 20 years ago was going to simplify things. Well, in many ways it hasn't. We're hearing about the use of artificial intelligence, how that's going to simplify things. And in many ways it hasn't. So the issue has to be, if you want me to adopt new technology, how's this going to improve my workflow?
Yeah.
How does this address generational issues in terms of, different specialties, different generations being able to utilize this technology and adopt it? Show me the science behind it, that it works, it's effective, and it's either going to save time, improve quality, save costs. Too often in the past, folks were just impressed by glitz, right? This seems pretty cool.
Right.
And now I think what's happening is people are also very jaded in
Functionality
terms
needs
of,
to be there.
what's going to work. So that's part of the challenge. And then, more and more is becoming virtual. Why do patients have to go into the office?
Well,
Why do I have to go into the
that's the
office
consumer side of what you're doing. If you
every
think
day?
about it, more people are online and more people are becoming consumers of health versus patients of healthcare. And I wanted to ask you about that particularly because you had an article posted about how different vehicles basically are needed to be used to reach more consumers.
Mhm.
So talk to me a little bit about that. Why do you think that way, and how do we get more people to think that way? Because that is absolutely true, and that's why the Ferrari or the Prius, if you're in San Francisco, is parked in the garage and not being used for its right usage. So talk to me about that. How do we get more of the amazing technologies and services to those consumers through these different vehicles?
Well, I think we have to evaluate technologies much more before we hype them in some ways. And because we recognize, to your point, that we're really having this consumerization of healthcare. It's almost as if healthcare is meeting retail.
Mhm.
So search has changed. So no one's searching joint pain and then printing it up. If anyone's watching that's probably older than 45 will remember, patients will print it up and then you bring it to your doctor and then the doctor just does whatever he or she was going to do. Now, patients are much more engaged. They want a telehealth appointment that night. They have a mole, they're going to download an app and take a picture, and they want a reading later that day. I can buy a Fitbit, an iPhone watch. I can monitor my own heart and try to look, for AFib. I can have wearables and trackers and sensors, all that's helping me diagnose. So where does the physician and pharmacist and other healthcare provider play into this? Because we don't want patients making all these decisions on their own. Yet in health, they often will listen to someone's anecdote. I often say to people when I give some talks, how many people fix their own car? And most people will say no. And I'll be like, well, why? Because they'll be like brakes. A car mechanic doesn't count if they're in the audience. There's brakes, there's electronics. They don't want to mess it up. Yet when it comes to people's
Their
own
health.
body, they'll read a blog by someone who tried shark cartilage for some condition, and they'll be willing to do it. And you think, we really have to evaluate more effectively and figure out the new ecosystem that allows what I'm calling and others patient centricity. You're going to bring care to me literally. Telehealth, remote patient monitoring, lots of apps and tools. I can do my own refraction at home for my vision. I can order a device from Amazon, put it on my iPhone, and then upload the data, and I can get a pair of spectacles from a company in India for $29.99 within a week. That's pretty good, for many people. But does it check for glaucoma? Does it check for macular degeneration? Does it truly give me a full eye exam? So people might then be delaying other types of care. I mean, it's an exciting time to be involved in tech. Yet I think things are going to change because it's going to be less focus on glitz, including for physicians in the office, and more focus on outcomes. How is this going to impact quality of care?
So I have two quick questions for you.
Yeah.
One, what is the next big disruption in healthcare? With that being said, of which we just talked about,
Were there two, or should I ask one at a time?
I'm going to ask one at a
I
time.
think it really is this consumerization where the consumer is going to be more control of their care. And the example I'll give is, when we talk about technology, there's development of these lasers that can detect your heart rate from afar and can help identify you in terms of who you are. And that can be used for security purposes and biometrics, et cetera. A lot of glitz sounds really cool. But what I'm interested that's going to be disruptive are these toilets
Yeah, I
that
was just gonna say the
you
smart
can put a
toilet, but
device
I was like, why
on
is
your
my mind
home,
going to the toilet? And then
and
I realized it's
it's gonna
not.
check it's gonna check stool for blood,
Yes.
one measure of colorectal cancer, but also hemorrhoids. It's gonna check your urine for ketones, which might indicate diabetes. It's trying to detect UTI. So here every day,
So smart
it's
homes, maybe.
checking.
Do you
It's
think smart homes will be a
continuous.
thing?
Pardon me?
Do you believe in smart homes being a big thing? Do you believe in that being the
I
norm?
think we're finally getting to that into components. And if you think about a toilet, something we all do every day, that's going to monitor my health literally
A
every
mirror
single day.
telling me what sunscreen I need because of how,
Absolutely.
how the sun is shining through the orbit. I mean, just
Yeah.
there's so much going on. And I love that because, we used to look at these things like a luxury. And actually I wanted to talk about those things like
But that's also where the consumer's in charge of their health
Yes.
and their
Well,
wellness.
think
That's the
about
disruptive.
pharmacogenomics. We have the information that we can tell based on you taking a certain medication and the effectiveness versus somebody else. We
Yeah.
have that technology now. Why is that not being used for
All
most
right.
people?
So, all right. Now, in all fairness, now you didn't mention at the beginning that I worked at the Food and Drug Administration for 5 years. So here's what I'm going to say about this, and we may differ a little.
No, please.
We have good data in the field of pharmacogenomics, particularly in cancer research.
Okay.
Other fields, not as much. So precision medicine, we still have a long way to go overall. And I'm going to be honest, there have been some bad apples in the field of pharmacogenomics who have said certain lab tests can talk about your utilization of different medications, and based on your genetic profile can say which medicines are right for you. That hasn't always panned out. In cancer, it's been a little easier because we're looking at the tumor, and then we're looking for markers and basing care on that. So I think that's still a few years off, to be honest, for most persons. So I don't think that we're there.
But is that a
But
big industry? Do you think that private companies can jump in this, fund this like we
I
do
think we
these?
are. I think we're moving into that. And I think we'll see more advancements in the next 10 years. But look at the field of diabetes. Lots of patients with diabetes, lots of different medications. Where's the field of pharmacogenomics in diabetes?
Listen, I try to cap co-payments down in Florida, and I didn't have much success because a lot of people don't like the capping issue. But
Mhm.
diabetes is a big issue. It's one of those low-hanging fruits, that we could create a
Where's the
precedence.
pharmacogenomics, Scott, in
You're
that?
absolutely right.
Yeah.
You're absolutely right. I mean, and look, I appreciate, you coming on the show. I think this is just a
Mhm.
start to a bigger conversation that you and I will have. My goal every day is to try to consumerize this
Yeah.
information, get it to a further audience. And as well, I'm all about pushing humanity forward. This is another episode of the Disruptive Front. Dr. Whyte, I appreciate you coming on today and
Sure.
really giving me a lot of great information. And where can people follow you actually?
Sure. Well, obviously, they can find me at WebMD. They can follow me on Twitter or Instagram. My name at Dr. John Whyte.
All right, everyone, that is it. And I hope you have a great day. Thank you.
Thanks, Scott.